Hello everyone, welcome back to our YouTube channel. Thanks for liking our videos. Thank you for watching. Thank you for subscribing to our YouTube channel. And if you are yet to subscribe to our YouTube channel, please do so by clicking on the subscribe button as well as the notification bell so you'll be notified whenever we post a new video. So on today's episode, I would like to talk about deworming, the continuation of my previous video. So if you are wondering what previous video I'm talking about, just scroll up to check my previous video. I talked about worm, so there is no way I'll be talking about deworming that I won't talk about worm, the worm infestation, and also their signs and symptoms, what they can do in human body. So in my last video, I'll just make a recap very quick. In my last video I said these worms can be, they are parasites and they can be inside of an human body or outside of an human body, probably on the skin or inside of an human body. So the most common one is that of the parasite or the worm is inside of the human body. So last week I talked about different types of worm, such as the hookworm, the pinworm, roundworms, and also other worms that we have that is very common in our society. In my last video also I said that all these worms can be found in our water, in our food, in the soil as well. So today, on today's episode, I will be talking about deworming. Deworming is a preventive chemotherapy or preventive measures that is used to prevent the worm infestation. So when we talk about preventive, that is, we are preventing it so it won't happen. And if eventually it happens or you have this worm, probably as a result of you've seen all the signs and symptoms in my that I mentioned in my previous video, and you notice that you have them, just run to your doctors, your nurses, your medical practitioners, and all the medical professionals, to help you get the treatment. Yes, there is treatment for worm infestation. So like I said, that these worms, they are very dangerous. They can cause intestinal bleeding. Yes, they can cause intestinal bleeding, and intestinal bleeding can actually lead to anemia. They can also cause impairments in of nutrient intake. That is when you see a child telling you, I don't feel like eating, telling you, I don't feel like taking anything, I just want to be. So there is impairment in their nutrient intake, or in nutrient digestion, and also nutrient absorption. So there won't be urge for them to eat, or there won't be urge for them to feel hungry. That's loss of appetite. Then also this a worm infestation can also cause intestinal inflammation, and also can cause intestinal obstruction as well as diarrhea and or vomiting. There are also some other signs and symptoms that I mentioned. Just scroll up to check my previous video. So deworming are preventive measures to prevent this worm from coming into existence in your body system or on your skin. So one of the ways in which we can deworm is, or how often do we need to deworm? We need to deworm based on different types of the worms that we have. Like I mentioned, we need to deworm every 3 months. We need to deworm every 6 months, and every annually, which is every year, depending on the worm infestation that you have. Probably it is roundworm, pinworm, whatever worms that you have. So we need to deworm either every 3 months, or every 6 months, or every year. So it has to be done periodically. So also, that what are the ways in which you can prevent this worm infestations? And is also water and food hygiene. Like I said, that these parasites can be found in our foods, they can be found in our water, in the soil. Water and food hygiene. Ensure that your kitchen are clean, they are hygienic, they are free from germs or pathogens. Ensure that your waters, the water you take, the water you use, they are also free from pathogens, they are also free from germs. And also, who are those that needs to get dewormed? We have this preschool age, we have, that is the age of from 1 year and above. We have the school age from 2 years and above. We have the adults, both male and female, and most especially we have the pregnant women. These are the set of people that we need to deworm. So don't say you are a man, you are a husband of the house, you don't need deworming. No, you definitely need deworming because it is a preventive measure. So like I said again, who are those that are at risk of getting this deworm? Who are those that are, if you fall into this category, definitely you need to deworm at least every 3 months. If you fall into category whereby you eat outside, you eat most often, you eat outside, you buy food outside, you take water outside, I mean water that is not free from jar, maybe probably tap water from outside, you need to deworm at least every 3 months. Or you fall into category of people where that of people that stays in a rural area or rural environment, or environment that makes use of stream water or river water, you need to deworm at least every 3 months, every 3 months. So I hope with this few hints and few points I've been able to help you understand that worms are dangerous, they are deadly, but at the same time you can prevent them from coming into existence in your body system. Thank you and have a lovely day.